Hello there. As of Friday, the EU has successfully coordinated 1,000 medical evacuations of Ukrainian patients via its civil protection mechanism to provide them with specialized healthcare in hospitals across Europe. As the number of wounded people in Ukraine increases day by day, local hospitals are struggling to keep up with the demand. At the same time, Poland, Moldova, and Slovakia have requested support for medical evacuation, so-called Medivac, and those operations from their respective countries given the large inflow of people. To relieve pressure on local hospitals since March 11th, the EU has been coordinating patient transfers to other European countries who have available hospital capacity. The patients have been transferred to 18 countries. Germany, France, Ireland, Italy, Denmark, Sweden, Romania, Luxembourg, Belgium, Spain, Portugal, the Netherlands, Austria, Norway, Lithuania, Finland, Poland, and the Czech Republic. Recent operations include the transfer of 2 patients to the Czech Republic on August 3rd and 15 patients evacuated to Germany, 4 patients to the Netherlands, and 2 patients to Norway on August 4th, so that already happened. The Commissioner for Crisis Management, Janusz Lenarčič, said about this, Russia's unjustified war in Ukraine is driving Ukrainian health systems to breaking point. To help Ukraine cope with the skyrocketing medical needs, the EU has stepped up its operations. On top of delivering medicines and medical equipment to Ukraine via our civil protection mechanism, we are also coordinating medical evacuations. 1,000 Ukrainian patients have been transferred to hospitals in 18 European countries. I want to thank all countries who are welcoming the Ukrainian patients in this critical time. EU solidarity saves lives. And European Commissioner for Health and Food Safety, Stella Kyriakides, said, from day one, the EU has been working tirelessly to support Ukraine and its people in the face of Russia's brutal military aggression. As part of this, the EU civil protection mechanism has allowed patients in urgent need of treatment and care to receive it in hospitals across the EU, while relieving pressure on the healthcare systems of Ukraine's neighboring countries. This is true European solidarity in action. Together with Ukrainian authorities, we are also looking into ways to bring patients back home when they have finished their treatment, if they choose to do so. This life-saving work will continue, as will the EU's unwavering commitment to supporting Ukraine. The medical evacuations are financially and operationally supported by the EU civil protection mechanism. The Medivac transfer scheme supports the transfer of patients that fulfill the eligibility criteria, be they chronically ill or wounded by the war. The mechanism enables the Commission to report to the Ukrainian authorities where in the EU or the EEA countries the patients have been transferred. For secure transfer of patient data, the patient's health records are shared using the early warning and response system, the so-called EWRS. And I'm glad the EU and the members of the EEA are supporting Ukraine even in this way. So it is good to have solidarity in the EU and the EEA. And I'll see you in my next video. I'll be back.